Steve Taylor with Think HR and Insurance Services. In this video, I'm going to show you why it's so hard to pick plans during open enrollment and exactly the numbers you need to look at to make the best choice for you. So let's dive right on in. So I'm going to put myself right over here. So these are real live plans on UHC. These are plans that one of our clients are looking at, and one's an HMO Silver and one's an HMO Platinum. So the first number we want to look at is if I never use my health insurance ever, don't even care to use it at all. I'm young, healthy, don't need it. You want to look at the premium. The first thing we want to do with the premium, because you're going to see something much like this where it says $600 per month, $850 for this one per month. We want to annualize these numbers. Why? Because all the numbers that you're going to look at when you're looking at this plan cost are going to be annualized. So when we take the $600, we multiply it by 12 months, $7,200. We take $850, we multiply it by 12 months, it's $10,200. Okay, great. Well, the platinum plan seems like it's too much if I never use the plan. Well, that may or may not be the case, right? What's the other number we want to look at? If I got hit by a bus 9 times this year, 9 times, and I needed to get surgeries, all that stuff, what's the most money I'll spend? Well, the out-of-pocket maximum for these services on this plan is $8,600 versus this plan is $4,500. So we want to add that in. So the lowest annual cost is $7,200 for the silver, $10,200 for the platinum. When we add in the out-of-pocket maximum, it's $15,800 versus $14,700. So now, all of a sudden, if I got hit by a bus 9 times, this platinum plan, even though it's $3,000 a year more, covers more, it's less expensive. Now, we're at the point where we can start to say to ourselves, okay, well, I guess it depends how I use the plan. So now if you're using the plan at all, the next thing we want to know is, when does insurance start to cover any cost here? Well, that, my friends, is what a deductible is. So when you look at the deductibles, the copays, all that, this deductible for the silver plan is $2,500. So that means that you need to spend $2,500 on services before the insurance company actually spends any money. Before they kick in a dollar, $2,500. On this plan, it's $0. So the first question you want to ask is, if you don't think that you're going to spend $2,500 and in the last 4 or 5 years you haven't even spent $1 on your health insurance, and you're okay with the idea of, hey, if I got hit by a bus 9 times, if I did that, I'm happy to retain that risk and I'll pay the $2,500 difference, keep it in my pocket, then this is great for you. Why? Because it's still $9,700 even if you spent $2,500. And then over here, it covers day one. They start to cover you. So insurance, all you need to do is spend your first dollar and insurance will split the difference with you. Now, how they split the difference with you starts to get into the plan design and how you use the services. I'll show you which numbers start to apply. But again, the goal of this video is to show you first, before insurance pays any money, before we look at our own special unique scenario, how exactly do we decipher the cost of the plans? And the numbers I just gave you are it. You take the premium, it's definitely coming out of your pocket. Then if you got hit by a bus 9 times, your highest cost is here. It's the out of pocket plus the premium. And then, okay, well, now that I'm looking at it, when does insurance start to pay? They pay after you've reached your deductible. You're all familiar with the deductible. It's the same way in car insurance, any type of insurance plan you have, you reach your deductible, then insurance starts to split the cost. So when we're looking at some of these other numbers, this is where it comes into, well, hey, if I go to the chiropractor 20 times this year, like most plans are designed to do, and on this platinum plan, 20 times 30 is what, $600 for the year. That's my copay for going to the chiropractor. But if I go on this silver plan, it's $1,800 for me to use it. So now, if the copay is $1,800 versus $600 over here, which plan is better? Or, hey, I'm planning on having a surgery. I only have to pay 90% is insurance, 10% for me. I have a $3,000 surgery, I'm paying $300. Over here, if I'm having to pay 35%, that means that I'm paying 1,050, right? So like it really does start to matter on how you use the plans and what services you're going to need when you're picking the plan design that works best for you. Again, this video was really meant for you to understand how the cost structure works so you can take simple plan designs and quickly decide which one makes the most sense for you. As you can see, if I never use the health insurance, I haven't spent $2,500, then I know the silver plan might be for me. But if I'm worried about, I haven't really used my health insurance, but I know I have some things coming up, well, now I should spend some more time and dive into, well, what services am I actually going to use? It's always a best practice to go into open enrollment and understand exactly how am I going to use my health insurance this next year? How can I possibly max out the benefits that I'm already paying for so that I have an advantage and the plans work out well for me? So I hope this was helpful for you. If you have more questions, this is something that we go over with our clients, employees during open enrollment. This is something that we go over when people are on the phone with us and we're picking plans. So we're happy to have a discussion where it makes sense. If you need any further help, feel free to reach out to myself for a strategy session and we'll get back to you. All right. Take care.